Hi everyone, welcome to Dr. Deepa's Learning Lounge. I am Dr. Deepa and I'm here to discuss one important topic of surgical pathology, cytopathology, or hematopathology on a daily basis. So, you have seen multiple lectures of mine, so stay connected with Dr. Deepa's Learning Lounge and like, subscribe, and share my videos and subscribe to all my YouTube channels and my website as well. So today we will be discussing pleomorphic adenoma. Pleomorphic adenoma, as you all know, is a benign tumor of the salivary gland which affects majorly the parotid. Almost 80% of the cases occur in the parotid. So what you're seeing here in this area is the normal parotid gland anatomy, and this is the tumor area. Without much ado, let me just start this whole slide image. So what are you seeing here? You're basically seeing three different components. One is the epithelial one, which is the ductal component, which is having inner layer of cysts and tubules. The myoepithelial component is the outer layer of these cysts and tubules, and these are scattered within a myxoid stroma. So whatever you're seeing here as these gray areas, these are the myxoid stromas. So the cytology of the myoepithelial cells can be plasmacytoid, spindled, epithelioid, somewhat clear, or it can also be stellate. The stromal component is typically myxoid or chondroid or chondromyxoid, like in this case. It can also, in some cases, be hyalinized or fibrotic as well. So this is the basic appearance here. So what are you seeing in these areas? This is the ductal element, and on the sides of this is the myoepithelium, and this background gray area is the stromal element. Okay, so let's still keep looking at these. So this is a higher power image. So what you're seeing, these long elongated areas, these are the myoepithelial fragments. These are the epithelial ductal elements. And the background grayish area is the stromal area. So by definition, pleomorphic adenoma exhibits a unique mix of epithelial, myoepithelial cells with some amount of stroma, as I already alluded to. The hallmark of this architecture is there is a diversity or cellular pleomorphism. In the sense, there is a mixed mesenchymal, myxoid, mucoid, or chondroid matrix. And the characteristic architectural diversity of the cytologic pleomorphism is a very basic feature. There is a mixture of the luminal, ductal, and abluminal supporting myoepithelial cells. So that is the basic histology of pleomorphic adenoma. 70% of these pleomorphic adenoma cases have some chromosomal abnormalities associated with it. The primary involvement of chromosomal abnormalities is involving the PLAG1 and HMGA2 genes. So these genes, through fusions and rearrangement, drive the tumor proliferation. The PLAG1 encodes for zinc finger proto-oncogene, while the HMGA is a chromatid remodeling protein. So this is very important. These are the most common genetic changes. 3p21 abnormalities are also common in this subset of tumors. These tumors have a normal karyotype. With the normal karyotype are usually very rich with stroma. So whenever the stroma is very rich, you are expected to have a normal karyotype in these salivary gland tumors. The pleomorphic adenoma basically accounts for both for the majority of the benign overall salivary gland tumors and the major chunk of the overall salivary gland tumors also. It is mostly seen in adults, but it can also have some amount of pediatric affliction also. The females are more affected than male adults, and in the children it is reverse. Male kids are more affected than female children. What is the common site of occurrence? It commonly affects, as I already told you, 80% of the cases affects the parotid gland, especially the superficial lobe. So the most common lobe of parotid is the superficial lobe that is affected. Occasionally, deep lobe is involved, including some parapharyngeal spaces also to be involved. Minor salivary gland involvement is the second most common, which includes palatal salivary gland, buccal mucosa, upper lip greater than lower lip. So these minor salivary glands also can be affected. Rarely you might see it in larynx, nasal cavity, orbit, or some areas of the GIT also. Clinically, what does it present as? It presents as a painless, slow-growing, mobile or to firm mass, rarely ulcerates and causes paresthesias. Overlying skin is usually intact, and recurrent tumors may present as multinodular masses, but again, you have to look for the malignant transformation in case of multiple recurrences, especially in a male patient. So the natural history is although it is benign, pleomorphic adenoma is known to grow extensively and may undergo a malignant transformation. Long-standing tumors or those with older male patients are at a higher risk of carcinomatous transformation. And the malignant variety of pleomorphic adenoma is called carcinoma X pleomorphic adenoma. So what does the treatment look like? The complete surgical excision is the primary modality of treatment. Sometimes you might do a superficial parotidectomy if you want to spare a bit of parotid for purposes of if you are doing not going to do an extensive surgery, then superficial parotidectomy is also an option. Extracapsular dissection needs to be done. Conservative excision can be done for minor salivary glands. Recurrence rate is less than 2.4% and up to 8% in the parotid tumors. It is prognosis is excellent if it is adequately excised. Okay, enucleation or scooping out of that particular tumor should be avoided because there is high risk of recurrence in case of enucleations. Imaging is primary modality of diagnosis in pleomorphic adenoma, like any other tumor. So imaging helps to understand the extent, location, and the features of the pleomorphic adenoma. High resolution ultrasound is usually useful, especially in children. MRI can support some amount of superior soft tissue contrast in case of deeper lesions. You might have to do an MRI. Grossly, these tumors look like nodular, irregular, encapsulated mass with a homogeneous white tan transient cut surface. And there may be some areas of hemorrhage, especially if it is a larger tumor, then it can have an hemorrhagic area also. Microscopically, like I already alluded to, pleomorphic adenoma displays a mixture of epithelial mesenchymal-like elements with no distinct boundary. Chondromyxoid stroma is something that is interwoven with the epithelial elements, which we also saw in the video. And metaplastic elements like sebaceous and squamous areas can be seen very frequently. So thank you for your patience. Stay tuned to Dr. Deepa's Learning Launch for many such more videos. So happy learning.